Hi, I am Amy Natt. I am the CEO of Aging Outreach Services, and this is all things aging.
And I'm Amy Phariss, editor of OutreachNC, which is our monthly publication. And today we're talking about what is a care manager. Okay, so I didn't even know what a care manager was before I started working here.
Okay, so you've already learned something.
I've already learned something, and they are truly like at the center
Yes.
of.
And it's not uncommon. I find that a lot of people have not heard the term care manager or really don't know what a care manager is until they find themselves in a situation where they need one.
Right. And I remember in my own family calling you and saying, this person has fallen and surgery and her husband can't take care. What should I do? And you said, find a care manager. Yeah. Okay. Right. So what is a care manager?
All right. So a care manager is typically a social service professional. They may have a background in social work. They may have a background in nursing. My background is in gerontology. And so there are several backgrounds or disciplines that come into care management, but essentially our role is to typically work directly with or for the family. There are some care managers that might work for specific organizations, but in our case, working directly with the family to help them navigate a variety of situations that people may face as they're getting older.
What's an example of when a care manager would come in?
So typically if a family is facing, it could be a new challenge, a new chapter in life. It could be that there's been some type of crisis, but some change, right? Where they might really start to think about, well, how do I want my life to look as I start to age? What resources might I need? If something happened, who would I call? Do I have adult children? Do they live in the area? When you start asking yourself those questions, what would happen if I did need care? Where would I find it? A care manager is a professional that would have all of those resources. And so they would easily be able to navigate for you what your options and opportunities are versus you spending hours and hours and hours trying to figure it out on your own.
So is a care manager usually hired by the person who needs the care or by the adult child or family member?
Right. So that's a great question. So it could be a variety of things. Typically, the care manager is hired directly by the client, which would be in many cases the older adult themselves, but we also have adult children that are helping to care for mom or dad. And so they may hire the care manager to help them navigate the situation as well. And then as the field of care management has grown, there are some definitely like medical practices, financial, legal advisors that sometimes will also either consult with the care manager for their clients, or in some cases, they may have a care manager on staff as well to be a resource for the clients that they're helping to navigate.
I can imagine it would be helpful if you were an adult child living out of state and you really didn't know what all the local resources are that your parents need, and you need somebody there locally.
Right. Yep. So definitely if you need a set of eyes, ears on the ground and you're helping to care for a loved one and you're not in the area, it can be extremely helpful to have somebody not only in that role of somebody that might be an advocate or a nurturer looking out for your family member, but also has the education to go with that. I also say I'm an educated adult daughter, problem solver. There's all kinds of titles, but at the end of the day, it's really helping people navigate typically the aging process the way they want it to be. So it's extremely individualized to that person in their situation.
So what are some of the specific things a care manager would do?
So there are a lot. So I'll go through like some of the common ones. So typically when we begin our first interface with a client, it's really educating them, right, on what a care manager is, what we can do. So sometimes the individual doesn't really have a good roadmap. They're not really sure if they've done the right type of estate planning, financial planning, what they want the next 5 years to look like. A lot of times we will go in and do a full needs assessment. So we're really looking at several core areas, which we'll come back to in a little bit, brought a visual for you, core areas of their life, and the care manager is helping them assess kind of what they have in place, what they might need to look at getting in place as the future goes, and how that might look and what those resources in their area are. So that would be if we were coming in and doing like a written report of suggestions, recommendations. Certainly a lot of our clients maybe don't plan ahead as much, and so they might come to us in crisis. So it could be somebody's had a fall, somebody has a new diagnosis, maybe a spouse has passed away and the other one is left now to be living alone, and adult children are trying to help navigate. There may be no adult children, and the older adult is looking for a resource to kind of be their advocate as they get older. And so they may come to us when they're in crisis. And in that case, instead of taking the time to be able to do kind of a full needs assessment, the care manager might be jumping in to help them navigate that crisis. Ideally, it's great when people come to us before the crisis happens. If we can help you plan and get to know you and sort of understand what your personal preferences are, what you would want in a situation, then it's going to be much easier for me to jump in that situation and be your advocate for things to happen the way you would want them to.
And I imagine you can help prevent a crisis.
Many times we can. So another part of what a care manager might do is an environmental assessment, right? So I may be able to come into the home and see loose throw rugs, that there's not grab bars in place, that there's some cords that might be a fall risk. And so there may be things environmentally that can be done ahead of time that would certainly prevent the crisis. And there may also be things when I'm, ideally with care management clients over the years, my favorites have been those that I get to go see once a week, right? Because then I can really see, is there mail stacking up? Is there food in the refrigerator that maybe has been there for weeks? Or are there other red flags, right, that person is showing me by being in their environment that the care manager could step in and preventatively help before the crisis occurs?
So you kind of are able to establish a baseline. So then you can see if something has changed.
Yes.
Whereas if you're coming in at the last minute, you don't see that progression.
Right. If you're coming in a crisis, you're not really sure what the baseline is. We have a lot of clients that come to us that are independent, but they're thinking, who would I call at 2 a.m. if I'm in the hospital, right? And maybe my spouse has dementia and my adult daughter lives hours away. And so with those clients, it's great because we can establish a relationship before that scenario occurs and get to know the person and what their baseline is and kind of what their preferences might be.
So when you're talking about this, I can see that you're passionate about this. You love this. This isn't a job for you.
Right.
It's like life. What inspired you to choose this?
So it's interesting. So when I was growing up, I was lucky enough to spend a lot of time with not only my grandparents, but my great-grandparents. And so my great-grandmother and I both kind of shared June birthdays. And so when we would go visit during the summer, I was able to spend a lot of time with her and be at her house and experience that. And then as she got older and there were not the resources then that there are now to help somebody age in place, she was placed in a nursing home. And so at a young age, I started going with my grandmother to the nursing home to see my great-grandmother. She volunteered there. We would go see other residents, take them snacks, do art projects with them. And so I got a lot of exposure, specifically in the long-term care environment, to both the positives, but then also it was very heartbreaking to watch someone that I had seen in their home and spent a lot of time with who was now confined to this nursing home. And so in the back of my mind, I always thought, well, there's got to be a better way to age. And so that motto kind of carried through. And when I got to college, I was like, you can get a master's in gerontology. And I happened to be at one of the schools that offered that. And so it was really great. So through my undergrad and graduate schooling, I was able to focus on psychology and aging, nutrition and aging, all of these topics that sort of go into gerontology. And then when I graduated, I just had to create the career path, and that happened to be care management. So
you've been a care manager.
Yeah, 25 years.
And then you also run overall business. Okay. So how do people know when they really need a care manager?
So I would say when when the problems are affecting your everyday life, right? So whether you're a family member and it's the stress level of thinking about maybe whichever family member, it could be mom, dad, sibling, it could be anybody, it could be a neighbor, right? But when there's concerns, when there's been falls, when you notice somebody is losing weight, when maybe they're not acting the way that they typically would, or you see things like there's been bills that haven't been paid or bills that have been double paid. There's usually these little red flags or indicators. And so I always say it's much easier. We see people that spend, months and months and months, what I would say sort of going around a dark room trying to find the light switch to figure out what to do. Whereas a care manager, I can come in instantly and illuminate what, help assess what's going on and how to not only stabilize the situation, but then plan for the future as well at the same time. And so when families are finding that they're stuck in that crisis mode and you're asking, is it time for help? It's typically time for help. Yeah.
So I just want to be clear, because as you're describing this, a care manager is not a caregiver.
Correct.
They're different.
Yes, and actually over the years our profession has evolved a little. We have a couple of certification programs, and we have a national trade association, which will link in the bio, the Aging Life Care Association. And so for those of us in order to kind of set that professional credential or standard, once we have the right credentials and years of experience and we've joined the Aging Life Care Association, they actually use the term Aging Life Care Manager. Back in the day, people used to say geriatric care manager, but the difference between that person and what I would say is kind of a hands-on caregiver is that the care manager is sort of the one helping to orchestrate the plan, who's the advocate, kind of the point person, but the caregiver is the one who's really in there, maybe 5, 6, 7 days a week, helping with the meal prep, helping with personal care, helping, if there's just safety supervision needed, right? Mm-hmm. So while the care manager might be hands-on, I might see my client for 2 hours a week, make sure they've gotten to their medical appointments, their medications are set up correctly, they're adjusting to those, there's food in the house, all of those things. But the caregiver may be there 8 hours a day, right, sort of implementing that plan of care and providing more of that kind of hands-on support.
Does the care manager ever interact with the caregiver?
All the time.
Yeah.
And so it can be, in different settings and scenarios, but, for the most part, if I'm a care manager and I have a client, particularly say trying to age in place in their home, my goal is to stabilize that. So if I come up with a plan of care, I want everyone involved in that client's home, whether it be, a private caregiver, a family caregiver, maybe they have a caregiver through, we just talked about hospice and palliative care, whoever is a part of that team, I want to have a care plan there that sort of gives everybody the same kind of directives, resources, tips for caring for that person. And so as the care manager, I would most definitely be kind of interacting with the caregiver or the family or anyone else to make sure that it's really a team approach.
And so when you're interacting, are you sometimes advocating?
Definitely. Yeah. And care management doesn't only happen in the home, right? People end up in the hospital. People end up needing to be placed in a facility. The care manager is there every step of the way. And so a lot of times that means being an advocate. Right. It might be being an advocate for that person financially. We've done episodes on financial caregiving. It might be emotional. It might be physical support, whatever advocacy that person needs, whatever voice they need, sort of making sure that their needs are being heard is what my job as a care manager is to do for them.
And do you ever have to advocate with their family? Like if the adult child wants one thing, yes, mom and dad want something else, are you sort of the bridge in between?
We have to make sure we know who the decision maker is. We can do a whole nother topic on power of attorney and kind of when that comes into play. But for the most part, it's important that we know who the decision maker is. And, if it's that older adult, then, one, we have to have permission to speak with their adult children or anybody with what information we would share. But also, certainly you get adult children that maybe don't agree. So we can do some family consultation sessions. You get blended families. So you have second marriages. So you may have adult children from one and adult children from another. And that can be tricky then as those two people are aging together. So many, many times we are facilitating, whether it be group emails, group conversations, just education in general, to advocate for whoever our client is, so get the whole family on board, because certainly there could be difference of opinions.
So then how do you determine the scope of services?
That's very consumer directed, mm-hmm, right? So I can make all the recommendations I want, but if you say to me, no, mm-hmm, I'm not doing that, there's not a lot, unless it's a situation where I feel like you're a harm to yourself or others, and I would need to get, a social service professional involved. For the most part, I'm making suggestions, recommendations, but I can't always make you implement those. So sometimes you kind of have to wait for the crisis to be able to step in and really help somebody.
So you might be able to see what's coming,
right? But
for somebody who hasn't lived it or seen it, yeah.
Sometimes you have to just kind of wait until that person comes to that realization, especially with adult children. They may say, Mom is fine. She may be a little forgetful. No, she said she got out twice today. She said she ate. She said she went to the grocery store. But I'll be like, well, when's the last time you opened Mom's refrigerator? Or have you checked the mileage on her car? Because I don't think she's really going anywhere. Just kind of perception versus reality. And so a lot of times we can have those conversations, particularly with family members, to try to get everybody sort of on the same page.
And I imagine even if they're not ready to take all of the suggestions,
yes,
they're at least comfortable with you when the time comes.
Right.
Mm-hmm.
Yep. So a lot of time, if I've provided resources, so say I've, provided option A, option B, option C, option A doesn't work out, then they're going to remember, okay, wait, there were some other backup plans that maybe weren't our main preference. For example, everybody typically, if I said, where would you like to be as you grow old?
Home.
Okay.
Yeah.
That's the general answer. And that's great, but it's not always realistic for everyone because of what needs they have, because of costs, many, many factors. So maybe that's plan A, but plan B is, well, if we have to make a change, then let's know what those options and resources are so you're not making that decision in a crisis.
That would take a lot of the anxiety, just knowing that there are options.
Yeah, like planning for anything, like knowing that there's, sort of different options out there. And today there are so many more resources than there were like in the day of my great grandmother.
Right.
So it's much easier.
So this all sounds great. And then I'm thinking, how's this built? Who's paying for this?
Yes.
What's the cost?
So this is another great question. So the majority of care management, I will not say all because there are some exceptions, but the majority is paid privately by the client. And typically it's billed like an attorney would bill. Sometimes there's a fee for the assessment, but otherwise it's pretty transparent hourly, right? So you as a client or the family could say, well, I want you to go, 1 hour a week to see mom. In a crisis, maybe it'd be more. There are some scenarios where there's an organization that provides care management as a part of maybe maybe it's a medical clinic or something, and that wouldn't be a private charge. And there are some grant programs out there and financial assistance, specifically when it comes to, cognitive issues. Sometimes there's some coverage or some grants you can apply for to get care management. And then recently we've seen long-term care policies will cover care management also because they've realized that it stabilizes the situation for the long-term care clients as well. So we're seeing care management become a more widely accepted and recognized service. And so as that happens, you'll start to see other funding sources willing to cover it because it really can be proactive and save money in the long run.
Okay. So finally,
yes,
how would someone find a care manager in their area?
So I mentioned our National Association, Aging Life Care Association, and I'm going to share with you a great infographic kind of before we close today. But if you go to their website, which we're going to link in the bio, aginglifecare.org, there's actually a great find a care manager. So you can put in a zip code, you can put in the area where you live or your loved one lives. And it's really great because it pulls up a whole listing of care managers in that area, but also what their credentials are and what their areas of practice are. And so you can see kind of what your options are to try to identify one. And, it's worth the consultation, right? So most care managers will do an initial consultation with you, sort of explain more what they can provide, how it might help in your situation. And so it's worth having that initial conversation, definitely. So well, I'm visual, so This is going to sum it up, right? So this is a great graphic, and we're going to link it in the area too. But if you're looking at care management and what they can provide, if you think of the client and the care manager kind of in the middle, this is a great graphic for the different things that care manager can do. We mentioned advocacy. They're not an attorney, but they can certainly work with your elder care attorney to make sure you've done your estate planning, your power of attorney documents. We mentioned crisis intervention, dealing with people who have health and disability. We talked about new diagnosis or things that come up that may change your ability to manage your activities of daily living. Dealing with the finances, right, of getting older, what it might cost, also what's going to be feasible options. Housing is an option for many people as they grow older, and there are different options. One of the others down here, as we talked about a lot, is family. Right? So you're dealing with the dynamics. Again, I think it's like a wheel. So here's the care manager and the client, and then local resources. Having somebody who's in your local community is going to know, what is the housing, who are the financial people that can help you, what resources are there for a crisis, the elder law attorneys, and really be able to advocate in the systems that they're used to dealing with every day. So this is just one that I really like to show. If you're visual like me, it helps to see the different areas that the care manager.
When you can really see how the care manager takes this holistic overview and is able to tie all of the pieces together.
Yeah, definitely. And it's very customizable. Like I said, it's very consumer directed. You're never kind of stuck for life with us, although we have clients oftentimes for 10, 15, 20 years that we've really been able to help navigate through every stage. So it's a very rewarding profession.
Well, thank you. Yes. You've highlighted what it is and how it can help, and I'm truly sold.
All right.
So thank you.
All right. Thank you, Amy.